Okay, so this is my final presentation for my research that I did for the semester. It's about coping with chronic disease. So, the general direction of pattern for my research is that patient empowerment influences how patients with chronic disease manage their lives. I found a definition from one of the articles that defines empowerment as having knowledge about one's health and being able and motivated to influence one's health. So, what I found during my research was that empowerment plays a major role in the health and well being of an individual with chronic disease. So, one article that I've read talks about the understandings for the processes of chronic disease self management, such as illness needs, available resources, and coping with illnesses. And self management refers to the ability of an individual in conjunction with family, community, and healthcare um, to manage symptoms, treatments, lifestyle changes, and psychosocial, cultural, and spiritual consequences of health conditions. And another article talks about the enhancement of web interventions to help patients manage their health with less supportive care. So basically, it talks about using web interventions to see how it influences the coping, how patients cope with their disease with the available resources that the web interventions provide. And then lastly, a third article measures the prevalence of chronic disease in adults by citizenship and to compare the types of services, methods utilized in managing chronic disease. So overall, with all those three articles that I've read, I found that patient empowerment reflects the ability of patients to take control and positively influence their health and health behavior. So, some of the limitations to the pattern of my research kind of it's I broke it down into questions here. So, one of the questions that I thought about while doing my research was how are others able to manage their health condition better than others? So I focused in like seeing if the lifestyle, attitude, or the financial issues influence if chronic disease can be controlled or prevented. And then also, what came into my mind was inherited diseases. So I try to do the compare. I try to compare how chronic disease patients who acquired the chronic disease sometime in their lifetime, how they cope with their or how they cope with their how they cope with their chronic disease, or what measures do they take into precautions for preventing chronic disease. And I wanted to compare that to how people who inherited a disease, just kind of like diabetes, how they cope with chronic disease with their disease because they already have it and there is nothing to prevent it. And then another question was what guides the right path to managing chronic health to greater positivity. So, with all those questions, I came up with my research question, which is what influences the coping methods for chronic disease among ill patients. So, that was my main focus of the whole research project of this semester. And so, the gathered informations that I've found during my research was that inadequate health literacy has been associated with poor management of chronic illness and has been identified as the social determinant of health outcomes. So basically, health literacy comprises the application of a broad set of skills to assess, comprehend, evaluate, communicate and act on health information for improved health and well-being. And then another is the behaviors of individuals has clarification about the role of behavior associated to health. So I've I found that the behavior between health professionals and other occupations, I found that the health professionals have lower prevalence in smoking, sedentary activity, diabetes, obesity, and coronary heart disease compared to the other occupations out there. And another one is the indicators of socioeconomic status, such as income, education, and occupation, are interconnected with one another to be defined to define their association with health. So basically, low incomes are associated with high levels of chronic disease and can lead to early stages of chronic circumstances. So the implications of the study is empowerment is considered to be a leading factor of ill patients as to can how one may cope with his or her health setting. And the coping mechanisms of disease is affected by the responsibility, perception, action plan, and knowledge of those that are chronically ill. I have found that knowledge of health is one of the essential factors that impacts the way patients deals with their health issues, and without these characteristics, patients may be at a greater disadvantage for not having the ability to seek the best way to self manage their health, and found out that web interventions for chronic disease patients have a beneficial effect on patient empowerment in people with various chronic diseases. Um, and it's it's seen that there's different prevalence of chronic disease by citizenship, so implying that different burden of primary care by citizenship. So basically, there could be language barriers, cultural barriers such as cultural beliefs, and being unfamiliar and migrants being unfamiliar with enrollment processes and health information can interfere with how well chronic diseases are managed. And overall, this study claims that patients of chronic disease are in authority of their own health, and it is up to them as to find the best possible way to manage their health condition. So, some of the recommendations that I have came up with there after my research was that more research could be considered in the subject of empowerment, so that way, say if further research has been done, other researchers can understand that empowerment has a major influence on the coping mechanisms of chronic disease, so they could be understanding how a patient takes authority over their lives and make the decisions to change for the better. And also, healthcare professionals could provide full educational information to patients. I mean, from this, I mean that health professionals could could educate their patients about their disease and provide useful information as to how to prevent further how to prevent their disease to become worse. So that's what I found out. And then provide a variety of online access to health to self management for different types of health concerns. So I I agree with the web interventions because I because they do provide convenience to chronic disease patients, and it helps them to engage more and become more involved in managing their health condition. And also, I found that further research can be conducted about inherited diseases. I haven't really touched base on any of the about inheritable disease, but I think it'd be kind of good to understand for further researchers to kind of look into, because you want to do the compare and contrast between um, you want to do the compare and contrast between how a person who inherited the disease copes with a person who may not have the disease yet but is about to is on on the break of getting that disease. So that's all for my project for my research question for coping with chronic disease.